now is the right time. It might not have been the right time 20, 30 years ago. I won't give too much away when I started. But I think now is the right time. I think they are realising actually that women do make a difference and that we need to be recognised. I started my nursing career in 1989, that's when I qualified. And I think then, like most people, I don't think my career was a clear path. I went on to do a degree, and then I suppose the biggest thing was becoming a nurse clinician, advanced nurse practitioner, stayed in renal medicine. But from a research point of view, I would say it was around the time that I became a nurse clinician, advanced nurse practitioner, that I really thought, yeah, I want research to be part of my job. However, I am totally passionate about being clinical, and that's how I've stayed. I've ended up with a job that actually, I think, it might have taken me a long time to get here, but it is a perfect job in that I am now being paid for 50-50. So 50% of my job is clinical and 50% of my job is research. When you reflect back, there are things that happen that do change how you think. I certainly experienced losing close people close to me quite early on in my 20s when I was starting out in nursing. That changes you, and I think when you've experienced that, I think it made me think that I can probably face anything. So it made me resilient, and we know that resilience is really important. I think other influences are things close to you, so family and work colleagues, and even patients. There are patients over the years that influence you. They're those that you never forget, and they certainly influence how you are in the future. So my biggest career challenge to date, I never thought I'd be saying this at my age of 51, I don't mind sharing that, has been my most recent job, which is a consultant nurse. As I said, it's a 50-50 job. I worked in one particular area for all of my career, be it very varied. I've now gone into a different specialty. I've put myself into a very different clinical role, working with different people, different patient population, and certainly it's kept me up at night sometimes. I've had those nights of not sleeping well. I think laughter is absolutely vital to everyday working life. So I'd like to think I laugh a lot. I might laugh inappropriately sometimes. I might laugh in the wrong situations, but I try and bring it into as many situations as I can. Laughter is part of everyday life. I don't think I could survive without laughter, if I'm honest. I am quite an emotional person. That doesn't mean I'm crying at work all the time, because I'm not. But I can cry at very simple things, and it's usually to do with humans or human interaction or something just sparks that. And I think that's what happens with patients. And, over the years you hear people saying you shouldn't show your emotions. Sometimes you can't help it. If it happens, it happens. You might have to control it a little bit, but I don't think there's anything wrong with showing some emotion, because it shows that you're human and that you're part of that interaction. My best supporters have been most definitely my family. I'm going to say my family because they've had to put up with me maybe, working at home at the weekends when I should have been doing more family fun things, shall we say. I've had many supporters. I don't think you can do any of this on your own. to make a difference, and making a difference for me is making a difference to patients, whether that's my interaction with them in clinical practice or actually doing research that improves things for them. Just get on with it to a certain degree. Be brave. You can do it, and don't think that you're not able to do it. If you think that piece of work or that's something you have done is good, then just stick your head up and take a risk. I'm very fortunate. I work in an organisation that has strong women in leadership positions that have driven an agenda to really try and develop that research culture in the organisation. And women are vital to that. That's the majority of our workforce. And the focus is for nurses and AHPs, and we need to give them opportunity and support. So now is the right time. I would say to people, find in your organisation if you've got research champions. I'm a research champion, so hopefully people know where I am and how to find me. And I'm not naive enough to think that everybody does know, because they don't, and that's part of our job, is to get that message out there. We're here to support. It's about finding those people that really do want to make that journey. Most of the NHS, most of healthcare is delivered by women. But, women traditionally haven't been seen in those more senior research positions. I think that's been recognised now. Women have been marginalised, not recognised enough. And, we're really important and we're good at it. And why shouldn't we celebrate women in research?